I had this successful VBAC at a hospital in Santa Monica, and it was a newer female doctor, and she was great. She came in the room and she was looking at the monitor, and we were laboring and like getting the mom into the vibe with the lights dim. And the nurse that we had was a midwife from England. So her team was very committed. And this doctor said that she was going to give her a chance to have a trial of labor, quote unquote. And she was looking at the monitor and she said, you know what? I'm just going to stand here and be nervous. I'm going to go somewhere else because it's not helpful. And she knew. Now that's someone who really supports. She let her deliver on a birth stool, which I never had another doctor later do that. So those are the kind of things that we need to have success in the hospital. And if you're the kind of doctor who knows that you're nervous about this, just like you talk about with breech providers, people who say that they do twins and stuff like that. If you are not comfortable, say, I'm probably not the best provider for you because it makes me uncomfortable, so that they can go and find somebody who really believes in them. Don't bullshit them. They deserve to have you tell the truth about how you feel.
This brings up 2 points for me. One is that if you're not comfortable with VBAC, why are you taking a VBAC client?
Right.
And secondly, in the cottage hospital example, if they hire laborists, is one of the questions going to be, are you comfortable with VBAC? Because it probably isn't. So they're going to hire laborists who probably are uncomfortable with VBAC to take care of people specifically who are VBAC. And probably, as we talked about last week, is it going to be a priority of these laborists to be VBAC supportive? Or are they just going to hire them because they're bodies and they can say that they meet the whatever fake guidelines they came up?
Yeah, I don't know how it'll be with the laborists but when we looked at what was happening with Kaiser, sometimes when you had these doctors that were doing shift work, they were different in terms of how they felt comfortable or not comfortable than the practitioners, the doctors that were normally delivering in that hospital. So maybe not. It'd be great if they had midwives that could come in and support VBACs. But, one of the things that Anastasia and I said in our live that I want people to remember is just because you get a hospital to lift their VBAC ban doesn't mean that they are going to necessarily have doctors there that are supportive or the staff that's supportive. And you and I have talked about this before. Your ability to have a successful VBAC is very determinant on where you are and if your providers are not fearful.
Another example of stage 1 thinking by administrators, when they say, well, we'll have a laborist and that way we'll be able to lower our C-section rate. Because what happened, when they looked at that, what they found was that it wasn't the laborists that lowered the C-section rate. It was the beliefs of the laborists. So some laborists had high C-section rates. Some laborists had low C-section rate, depending on what kind of practitioner they were in the first place. So it has nothing to do with having somebody there. It has everything to do with the philosophy and the ability and the skill and the confidence of the person that they're hiring, not just that there's a body there.